And we know that grievers have a lot of anxiety and stress, and grief affects not just our mind and not just our heart, but our body, and our whole nervous system responds to the loss, to the grief and the pain. And so what I do is I use somatic practices to help women learn how to regulate their nervous systems so they can spend more time in that place of connection and freedom, so that they can live life fully living, fully feeling. And that's the topic I'm going to get into. And what I've noticed is that essentially women all come to me for the same reason. They're looking for relief, whether it's, the trauma is traumatic grief or some other trauma. But if we're going to even look at, traumatic grievers, they're all coming looking for relief from something. And it's from anxiety, depression, overwhelm, the chronic illnesses, chronic pains. I call it the chronics. And so what I do is we do the nervous system. We learn coping strategies through nervous system regulation, because we need that to adapt in this life of pain and suffering. But that's not the healing work. The healing work is what I'm going to talk about, and that is having the capacity of finding that felt sense of safety in the body, to feel safe to feel, so that we can feel in the present what was too overwhelming to feel in the past, so we can process in the present that was too overwhelming to process in the past. That's the healing work, I believe, in my role.